Good morning, everyone. Today I will be talking about the journal club topic aesthetic improvements of post orthodontic white spot lesions treated with resin infiltration and microabrasion, a split mouth randomized clinical trial published in the Journal of Angle Orthodontist with an impact factor of 3.2. Coming to the terminologies which are discussed in this journal, which we should know, are white spot lesions. These are early enamel demineralizations appearing as an opaque spot on teeth. Resin infiltration. It is a technique using low viscosity resin to penetrate and seal the enamel lesions. Microabrasion. Removal of the superficial enamel using acid and abrasive particles to improve aesthetic appearance. R value, ratio of lesion area to total tooth surface area used to measure lesion size. And delta E, it is a numerical measure of color difference between treated and untreated tooth areas. Coming to the novelty, aims, and objectives, it is the first long term 12-month randomized split mouth trial directly comparing resin infiltration and microabrasion for post orthodontic white spot lesions. It uses combined use of clinical photography and spectrophotometric techniques for objective and aesthetic assessment. Quantitative comparison of the lesion size reduction and color change over multiple time points is done. Aims to evaluate and compare the aesthetic improvements of white spot lesions treated with resin infiltration and microabrasion, to assess the durability of each treatment method over a 12-month follow-up. Objectives: measure the changes in the lesion size at baseline, 1 week, 6 months, and 12 months post treatment. Measure changes in tooth color also between the lesion and the surrounding enamel over the same intervals, and determine which treatment provides greater long term aesthetic improvement. Coming to the materials and methodology, the participants were 20 between the age group of 12 to 19 years with post orthodontic white spot lesions. Teeth: 128 anterior teeth affected by the YSLS. Resin infiltration kit was purchased from DGM Germany Icon brand. Microabrasion kit Opalusture Ultradent USA. Equipment: digital camera with macro lens and ring flash for standardized photos, crystal eye spectrophotometer from Japan for color measurement, and Photoshop software for lesion area analysis. Methodology: design randomized split mouth clinical trial, one side resin infiltration, other side microabrasion. Resin infiltration procedure: etching, drying, resin application, and light curing. Microabrasion procedure: apply abrasive slurry with rubber cup at 500 rpm for 30 to 40 seconds. Rinse, repeat up to 10 times. Measurements: resin size from standardized photos. Color change using spectrophotometer. Time points: baseline, 1 week, 6 months, and 12 months. Analysis: repeated measures ANOVA for comparing groups over time. When we talk about the statistical analysis, they used multifactorial analysis of variance with repeated measures and pairwise comparisons. Parameters were compared for R value and the color difference between teeth. Outcome: when we talk about R value, both treatments significantly reduced lesion size. Resin infiltration consistently had lower R values than microabrasion at all follow-ups. Delta E, both treatments improved color. No significant difference in color change between groups at any time point. Results: participants were 16 with 108 teeth and 12-month follow-up. Lesion size: significant reduction after both treatments. Resin infiltration maintained stable low R values from 1 week to 12 months. Microabrasion showed gradual further reduction between 1 week, 6 months, and 12 months. Resin infiltration had significantly lower R values than microabrasion at all time points. When we talk about color change, significant improvement was seen in both groups after treatment. No significant difference between the delta E between resin infiltration and microabrasion was noted at any time period. Durability, both treatments maintained aesthetic improvements over 12 months. Resin infiltration showed greater lesion size reduction overall, but similar color improvement to microabrasion. When we come to the strengths of the study, it was randomized split mouth design, minimized individual variability by having each patient serve as their own control. Long term follow up was done, which provided reliable data on treatment durability. Objective assessment methods using standardized clinical photographs and spectrophotometry was done. Direct comparison of two minimally invasive techniques, that is, the resin infiltration versus the microabrasion in the same clinical setting, was done, and clear study population with comparable lesion characteristics was noted. Limitations: small sample size, 16 patients completed, may limit generalizability. Single center study may not reflect diverse clinical settings. Follow up limited to 12 months. Incomplete lesion removal in both techniques due to depth limitations. Potential bias was introduced from split mouth design if carryover effects occur, though considered minimal here. When coming to the study guidelines, what type of study design was it? It was a randomized split mouth clinical trial. Each patient received both treatments, resin infiltration on one side and microabrasion on the other, with random allocation. Checklist compliance with consort for randomized trials. The checklist items that were not or partially followed were: no formal sample size calculation, limited reporting on blinding of outcome of the assessors, no trial flow diagram showing recruitment and dropout details, adverse effects reported only in narrative form. When we talk about the future directions of the study, we can conduct multi-center trials with larger, more diverse populations to improve generalizability, extend follow-up beyond 12 months to assess long-term stability, explore combined treatment approaches for deeper lesion management, investigate advanced imaging methods to accurately assess lesion depth before treatment, and evaluate patient-reported outcomes such as satisfaction, quality of life, and treatment preference.